Horsford, and just for the members that are in the queue, we have about 30 minutes left. So if members can keep their questions or statements short, that would be helpful. Next up is Congresswoman Emily Randall from the state of Washington.
Thank you, Madam Chair. As everyone here knows, we are on day 15 of this shutdown that's impacting families and our communities. And meanwhile, Speaker Johnson and our Republican colleagues refuse to even negotiate extending the ACA's enhanced premium tax cuts while open enrollment begins in just 2 weeks and families are making their decisions about their budgets and their healthcare coverage. In my district, families will see their healthcare costs rise by an average of $1,510 due to the big ugly law. And for a family of 4 earning $64,000, costs will jump by $2,571 if they're receiving the tax credit and all of a sudden don't. I don't know any family making $64,000 who can absorb that kind of increase in their budget. Families who are struggling to afford rising rents, families who are struggling to afford rising grocery prices, who are working hard to pay rising energy costs, all because our Republican colleagues refuse to take action to lower costs and protect healthcare for people. Ms. Holcomb, I know your family relies on the ACA tax credits, as you've already talked about. And Speaker Johnson and House Republicans claim that there's plenty of time to figure out the future of these credits, that they don't expire till December 31st. This can be a December problem. We can worry about it later. Can you explain to the Speaker and his Republican colleagues why waiting until December 31st to extend these tax credits is way too late and what that delay would mean for families like yours who are already receiving premium notices?
Well, I think my answer to the question is with the expenses increasing, life changing dramatically as far as food costs, as far as utilities increasing. There's been a lot of changes over the last couple of months, and there's a lot less money, especially in our home. So I have to plan accordingly, just like a lot of other families have to do right now. You have to do things differently than you used to do. You have to look at the big picture. And 2 months is not a long time from now. And I budget. I dot the I's, cross the T's. I have it down to a penny. And a lot of people do the same thing that I do when you're working on a budget. That's how it works. But I can't work with a budget when I don't know what is going to happen. So I can't wait to figure it out come January 1st when I get my health insurance bill and it's $2,200, because then I have to start dipping into our life savings that we worked really hard for. And we didn't work hard for it for health insurance. We did that so that we could enjoy life as we're older. We've worked really hard.
You so much.
Thank you.
I think there's a lot of stories like yours that it feels like our Republican colleagues are just not listening to or aware of. I don't know what world they're living in, but every person in my district is struggling with affordability and the cost of healthcare. Thank you for sharing. Madam Chair, I yield back.